let's jump right in. Today, we're talking about something huge. It's one of the leading causes of preventable blindness on the entire planet, diabetic retinopathy. Now, it is a very serious complication of diabetes, but here's the crucial part, and I really want you to hear this. With the right knowledge, this is absolutely a fight you can win. Just look at this. On the left, you've got a perfectly healthy retina, the back of your eye. It's clean, the blood vessels look great. But on the right, that's what a retina damaged by this condition looks like. You can actually see those dark spots, the bleeding, the hemorrhages that just start to cloud up your vision. The difference is, well, it's night and day. So the million-dollar question is, how does a healthy eye get to this point? Especially when, and this is the crazy part, you often don't feel a single thing in the early stages. There are no warning signs. This disease is like a silent saboteur, just working away in the background. So in this explainer, we're going to pull back the curtain and see exactly how it operates. To really understand the damage, we first have to understand let's call it the scene of the crime. So let's take a super quick look inside the eye at the retina itself. So what is the retina? Think of it like the sensor in a digital camera. It's this paper-thin layer of tissue way at the back of your eye. And its job is to catch all the light that comes in and turn it into electrical signals that your brain can understand. Simply put, without a healthy retina, there's no vision, period. And here is our map of the area. You can see this whole network of arteries and veins. That's its blood supply. You can see the optic disc. That's where the optic nerve plugs into the brain. And right there in the center, that little spot is the macula. The macula is responsible for all of our sharp, detailed central vision. It's what lets you see faces, read a book, basically everything that's right in front of you. Keep this picture in your head because this right here is ground zero. Okay, now it's time to introduce the culprit. And this isn't some sudden blitz attack. It's more like a long, slow war of attrition waged by just one thing: sugar. So here's the bottom line. Blood sugar that stays too high for too long, what doctors call chronic hyperglycemia, is basically toxic to those tiny, fragile blood vessels inside the retina. Over the years, it just slowly poisons them, weakening them from the inside out. Now, to really get how that works, you gotta meet the unsung heroes of your blood vessels, these little things called pericytes. The best way to think of them is like an essential support crew. They actually wrap around your tiniest blood vessels like scaffolding, giving them strength and making sure they don't leak. They're the gatekeepers. And this slide is fascinating because it shows you exactly what's going on at a microscopic level. On the left, that's a healthy vessel, totally supported by its pericyte crew. But on the right, that's what happens in diabetic retinopathy. Those high sugar levels actually kill off the pericytes. And without that support, the vessel wall gets weak, it starts to bulge out, and it starts to leak. And this is where the story takes a really dangerous turn. As all this damage starts to add up, the body tries to fix the problem. But tragically, its solution only pours gasoline on the fire. So as these tiny vessels get more and more blocked, parts of the retina start to suffocate. I mean, they're literally being starved of oxygen. And in a total act of desperation, the retina sends out this chemical SOS signal. It's called VEGF for short. And its message is pretty simple. Help, we're dying. We need more blood flow. Grow new vessels right now. Now, this damage doesn't happen overnight. It actually moves through these pretty predictable stages. It starts small, with just a little bit of swelling, then gets worse with more bleeding and more blockages. And it all builds up to the most dangerous stage, proliferative diabetic retinopathy, which is when the body's flawed rescue mission really kicks into high gear. This infographic just lays out the whole journey perfectly. You can literally see the damage building up, from these tiny little changes in stage 1 to the widespread chaos in stage 3. And then finally, you see the growth of those new blood vessels in stage 4. But here's the problem. These new vessels aren't the solution. They are the crisis. They're fragile, they're abnormal, and they grow all over the place where they're not supposed to be. And because these brand new vessels are built so poorly, they break and bleed incredibly easily. And when they do, all that blood leaks into what's called the vitreous. That's the clear, jelly-like stuff that fills up your whole eyeball. And that event, that's called a vitreous hemorrhage. This diagram shows you exactly what that looks like. The blood just clouds up the vitreous gel, physically blocking light from ever reaching the retina. For the person experiencing it, it might just start as a few dark floaters, or their vision could be almost completely wiped out in an instant. It's one of the most serious complications of this entire disease. Okay, I know that all sounds pretty terrifying, and it is, but, and this is the most important part of this whole explainer, the story does not have to end there. So let's shift gears and talk about how you can take control and protect your own vision. The number one weapon in this fight, it's detection, period. Because this disease works in silence, regular, comprehensive eye exams are completely non-negotiable for anyone with diabetes. Your eye doctor can use a bunch of different tools to spot the earliest signs of trouble, whether it's by looking directly at your retina, taking these incredible cross-section pictures with an OCT scan, or using photography to document everything. And if it is found, the great news is we have a powerful arsenal of treatments. The foundation, of course, is what you can do every single day, keeping tight control of your blood sugar, blood pressure, and cholesterol. For more advanced cases, doctors can use laser therapy to seal up those leaky vessels. And remember that SOS signal, VEGF? We now have these amazing injections that can block that signal, basically telling the body, hey, stop growing these dangerous new vessels. And in the most severe cases, surgeons can even go in and clear out all that blood to help restore vision. All of these incredible treatments, all of this science, it all points to one single crucial takeaway, and it's right here. This is not a story about inevitable blindness. It's a story about a manageable condition, where catching it early and managing it consistently are the absolute keys to protecting your sight for a lifetime. And that brings me right to the final and maybe the most important question. This damage, it doesn't send a warning text. It just happens, silently, in the background. So I'll just leave you with this one thought. When was your last comprehensive eye exam?